Surgery. For early-stage mesothelioma near the chest wall or diaphragm, surgery may be able to completely remove the tumor. The most common type of surgery for mesothelioma is called extrapleural pneumonectomy, EPP. This is an aggressive surgery where the lining of the lung, one whole lung, the diaphragm, and part of the lining around the heart are removed. Some other surgeries include pleurectomy, decortication, PD, where only part of the pleura is removed, or lung-sparing surgery where most but not all of the pleura on lung are removed. These surgeries can potentially help lengthen survival, but they carry risks as well due to their invasive nature. Radiation therapy. Radiation therapy uses high-powered beams such as X-rays or protons to kill cancer cells and shrink tumors. It is often used along with chemotherapy for mesothelioma. For pleural mesothelioma, radiation can be delivered directly to the chest wall after surgery or to relieve symptoms from a growing tumor. For peritoneal mesothelioma, radiation may be used after surgery in some cases to try to kill any remaining cancer cells. Most centers recommend radiation therapy as part of multimodality treatment whenever possible. Chemotherapy. Chemotherapy uses anti-cancer drugs that are administered through or by mouth to kill cancer cells throughout the body. Many chemo drugs can potentially help slow or stop mesothelioma growth. The most commonly used chemo drugs for mesothelioma are pemetrexed, Alimta, and cisplatin or carboplatin. These treatments are typically given in cycles, with each cycle consisting of treatment for several weeks followed by a break to allow recovery. Chemotherapy alone or in combination with surgery and/or radiation offers the best chance for longer survival with mesothelioma. It may be used as initial treatment prior to surgery to potentially shrink tumors or given after surgery to target any remaining cancer cells. Targeted therapy. Targeted therapy uses drugs that target specific vulnerabilities in cancer cells in order to kill them while doing less harm to normal cells. Some targeted drug options used to treat mesothelioma include bevacizumab, Avastin, which targets blood vessel growth, and immunotherapy drugs that help mobilize the immune system to recognize and attack the cancer. Research is still exploring optimal ways to incorporate these newer treatments into mesothelioma treatment plans. Clinical trials. Clinical trials are research studies that test new drugs, therapies and treatments to see if they are safe and effective for people with cancer, including mesothelioma. Participating in a clinical trial is often the best option available for some patients where standard treatments have not worked. New therapies targeting specific gene mutations or approaches like vaccines are being tested in clinical trials around the world for mesothelioma. Supportive care. In some cases where curative treatment is no longer possible, the aim of treatment shifts to palliative or supportive care focused on relieving symptoms and improving quality of life. Options can include pain management, draining fluid collections, nutritional support, oxygen therapy, or minimally invasive procedures to help address growing tumors and prevent or fix complications. Maintaining nutrition, exercise, stress management and social, emotional support are also vital components of caring for advanced mesothelioma. Melanoma treatment options. Surgery. Surgery is often the first line of treatment for melanoma, especially for early-stage melanomas without spread to lymph nodes or distant metastasis. During surgery, the melanoma tumor is removed along with some surrounding healthy tissue in an attempt to eliminate all remaining cancer cells. Options may include simple excision, Mohs surgery, or more extensive lymph node dissection, sampling depending on melanoma depth and characteristics. Sentinel lymph node biopsy can identify spread to nearby nodes. Radiation therapy. Radiation uses high-energy rays to destroy cancer cells. It is not often used for early-stage melanoma but may help control symptoms or shrink tumors in advanced disease, especially when there is spread to the brain or bones. It can also help after surgery for patients at high risk of recurrence. Chemotherapy. Chemotherapy uses anti-cancer drugs to destroy melanoma cells. It tends to be reserved for a later stage or advanced melanomas that have metastasized, as early-stage disease often responds better to surgery. Common chemo drugs used are dacarbazine, temozolomide, carboplatin, paclitaxel, and others often given in combinations. Results are often temporary but can curb disease progression and help control symptoms. Targeted therapy. For melanomas with specific mutations, matching targeted therapy drugs may help control cancer growth. Common ones include BRAF and MEK inhibitors for melanomas with BRAF mutations, and immune checkpoint inhibitors are revolutionizing treatment of many advanced cases. These work with lower toxicity than traditional chemotherapy in many cases. Immunotherapy seeks to mobilize the immune system to recognize and attack cancer cells by blocking certain inhibitory receptors on T cells called checkpoints. Ipilimumab, pembrolizumab, nivolumab are some examples used for melanoma treatment. Alone or combined with targeted drugs, they have produced durable responses and longer survival benefits in many late-stage melanoma patients compared to chemotherapy alone. Clinical trials. As with mesothelioma, melanoma clinical trials investigate new ways to use existing therapies more effectively and test new drugs, vaccine approaches and treatment combinations against this cancer. Actively accruing trials offer the potential for incremental progress and new options, especially when standard treatments have failed. Integrative therapies. While not replacements for medical treatment, some integrative approaches like stress relief, nutrition, and physical activity may help improve symptoms, quality of life during and after melanoma treatment. More research is still needed on their effects on cancer outcomes. Support groups also provide valuable emotional and social support. Treatment for each of these cancers is highly individualized based on tumor characteristics, stage of disease, patient health, and other factors. While challenging, major progress has been made for many patients through multidisciplinary care involving various combinations of local and systemic therapies. Clinical trials also offer hope for more personalized and effective options still on the horizon. Maintaining a proactive yet realistic perspective is generally best for quality of life when facing serious cancers like mesothelioma and melanoma.